Today in this video we will discuss about ultrasound finding of liver and right kidney. Right kidney is normal, no stone, no hydronephrosis is seen in this particular video. When we compare the ecotexture, liver shows enhanced ecotexture that is labeled as fatty liver. Second video shows also shows a fatty texture. When we compare the texture with right kidney, you can see the liver shows enhanced echogenicity. In this video, the right kidney shows hydronephrosis with proximal dilatation of ureter due to the stone present in proximal ureter, leading to hydronephrosis with proximal dilatation of ureter. When we talk about gradings of fatty liver, in grade 1 shows enhanced echogenicity, hepatic echogenicity, but periportal and diaphragmatic echogenicity is still appreciable. In grade 2, diffuse hepatic echogenicity obscuring periportal echogenicity, but diaphragmatic echogenicity is still appreciable. In third, diffuse increased hepatic echogenicity obscuring periportal echogenicity and diaphragmatic echogenicity. So in the third video you can see this is a urinary bladder filled with urine, shows free floating low level echoes, and urinary bladder wall is also thickened, so this is labeled as cystitis. Now another video shows a left kidney which is showing a renal medullary cyst at mid pole. So renal cysts are divided into cortical cysts that only involve cortex, or medullary cyst as shown in this video, that is called medullary cyst, or corticomedullary cyst that involve cortex and medulla. Now we briefly talk about findings of ultrasound abdomen. When we are scanning the liver, then first of all that we look at the size of liver, then we look at the texture of liver, that can be coarse, fatty, congestive,